you take the tablet that you have to your refrigerator and let me see what you have in there?
In this video, you will be guided through a telehealth education session, where the healthcare practitioner is able to not only assess patient knowledge, but the patient's home environment. This is a unique feature similar to a home visit. Too often, patients leave the hospital with changes in their medication regimen. Issues that may occur include confusion on which medications to take and which ones to discontinue, failure to pick up medications at the pharmacy, and a lack of understanding of potential interactions with certain medications and foods. A follow-up visit by telehealth within 24 hours of discharge can prevent such medication errors. Having patients read and write on the medication labels can be helpful.
Good morning, Mr. Batcher. My name is Christy, and I'm the nurse that's going to be doing your telehealth visit since you returned from the hospital.
Good morning. How's it going?
Very well, thank you. How are you doing?
Doing okay. Here I am.
All right. You glad to be home and not in the hospital anymore?
Boy, am I glad, yes.
So most of the symptoms you were having before you went to the hospital are improved?
Oh, do I feel so much better.
Okay, great, great. One thing I want to check is I want to be sure we're straight on the medications that they put you on since you left the hospital.
Okay.
Do you have those available, and can I see all the medication you're taking, including any vitamins or supplements?
Okay, I got a bunch here.
I'd be happy to look at all of them.
Okay, do you want me to read it to you or do you want to see it?
You can read it to me, that would be great.
Okay, this is for Leprosor, 50 milligrams tablet.
Okay, Lopressor.
And it's take one tablet by mouth once a daily.
Okay.
How do you learn to pronounce these things?
Trial and error.
Another Leprosor, 100 milligrams. The other one was 50.
Okay.
And that's also take one. So I'm going to take both of those?
No, the Lopressor 100 has been changed. So that one you need to put a big X on so you know not to take that.
Should I do that now?
Yes, might as well.
Yeah, because I tend to forget things.
Yeah.
So the 100, I'm putting the X on.
Yes, sir.
Feel like Atorvastatin.
Okay, atorvastatin.
80 milligrams. Take one tablet by mouth once daily.
Okay.
This is Losartan. 50 milligrams. One tablet. Okay, then there's warfarin. 5 milligrams tablet. Take one tablet by mouth.
Okay, once a day, correct?
Yes, once daily.
Okay.
And then furosemide.
Furosemide, yes.
You say it so well. 20 milligrams. One
Okay.
tablet by mouth once daily. Those are all the pills I have here.
Okay. Anything else? Any other supplements or vitamins that you take?
No, my wife tries to get me to take them, but I don't.
Well, let's talk about the medicines that you have there. I know you X'd out that one medication that was 100 milligrams, the Lopressor 100, so that's correct. And then the Losartan that you have, that one has been discontinued as well. So you need to put an X on that, and I'd like to see the bottle after you do that.
So eventually I'll throw these out then, right?
What you're going to do is take them back the next time you go to the pharmacy, and the pharmacy is able to dispose of them properly, okay? We don't want you to put them in the trash or putting them down the sink or the toilet or anything like that. The pharmacy can get rid of those for you, and that's very important, okay?
Okay.
All right. How have you been doing with eating? How's your diet been?
Oh, man. I think that's one thing that's really improved. I've enjoyed eating.
Okay. Now let's take a look in your refrigerator.
Sure. My wife keeps it pretty well stocked for me. You want to see the whole refrigerator?
Yes, if you can turn the camera around. I see you have some kale in there.
Yeah. Ugh. I mean, it's good.
Go down to the second shelf if you could. Let's see what else is in there.
That's one of my favorite. A little spinach.
One of the concerns, though, is because you're on that medication warfarin or Coumadin.
Right.
Foods like spinach and kale kind of counteract the benefit that the Coumadin is supposed to do for you.
Oh.
So we need to be sure you either don't take any of that at all or very, very limited amount of those items, the spinach and the kale.
I'm okay with that on the kale. Okay.
And now we need to walk to your pantry, and we're going to take a look at some of the items you have in there.
Okay, this is our pantry.
Okay.
What is it that you're looking for, though?
I just kind of wanted to see what sort of staples you have in there, because we have to be careful about the sodium intake that you have. And I see that you do have some canned soup in there, and unfortunately, they're often really high in sodium.
Well, I've got this chicken noodle soup.
Yeah.
Oh, it says 25% less sodium.
Okay, let's read the label if we can. Can you turn it over and read the label to me?
Sure.
Tell me how much sodium is in that.
It's got 660 milligrams, 29%.
So that's almost a third of the daily recommendation of sodium in one soup can. If you look at that carefully, is the whole can 1 serving or is the whole can 2 servings?
2.5 servings.
Wow, so that means in that one can the sodium is way over 1,200 milligrams.
Wow. Living on Campbell's chicken noodle soup since I was a little kid. Are you telling me no kale, no spinach, no soup?
Well, you'll have to alter things a little bit. You know, I don't want to never say never, because that's a setup for failure, but you have to be very mindful of the sodium that you're taking in, and if you do any spinach, it has to be very, very limited.
Okay. Wow, I'm learning a lot.
And now we need to walk to your medicine cabinet.
Okay. Okay.
Do you have any pills in there that are your pills? Any supplements?
Yeah, I got this one prescription, hydrochlorothiazide.
Right. That one has been discontinued. So you need to be sure you put an X on that one and take that one back to the pharmacy the next time you're there to have it disposed of, okay?
Okay, so I probably should just take it out of the medicine cabinet right now.
Yes, and be sure
What were the other ones I did an X on?
put an X on it and take it back to the pharmacy.
Earlier you asked me about a supplement. I just realized my wife makes me take this one. L-lysine.
Okay, I'm glad we went over that, because that's another one that might interfere with the Coumadin that you're taking, the warfarin.
Holy moly.
Yeah, so you need to not take that one either right now, okay? Put an X on it so you don't forget.
I don't see anything else in there. You want to take a...
Okay, yeah, turn the camera a little bit more so I can take a peek. Okay, nothing else in there you're taking, correct?
Nope, nothing else.
Okay, great.
So you can tell a lot just by looking through my iPad.
Yeah, absolutely. It's really good that we see that, because you'd kind of forgotten about that supplement and that other medication that was in there.
Right. So you'll trust me to put the X on, or do you want to see that too?
Well, you can take it back and put an X on it. I can check those out when we end the visit, okay?
Okay.
Well, we're back where we started.
This is the end of our first telehealth visit, Mr. Batcher. How do you think it went?
Actually, I thought it was pretty cool. I thought you were just going to sit there and kind of talk to me, but it was really helpful to kind of go through the house and have you confirm, and I guess I'll do what I'm told to do.
Anything we could do that would make the next visit better for you?
I've got to learn how to kind of use this camera maybe a little better, but it's been really helpful. And I tell you what, a whole lot easier than finding a parking place and putting myself at risk in a public place. I really appreciate being able to stay home and have this conversation.
And you know how to get a hold of the office if you have any questions, right?
Yes, I do.
Okay.
So does this mean I'll never go to the doctors again?
No, not at all.
Okay.
It's just this is a good way to do a visit, and it certainly fit the way we needed to do the visit today.
Well, I've never had the doctor's nurse in my refrigerator, my cabinet, and my medicine cabinet, so I feel a lot better.
I really thank you for your time today, and thank you for showing me around your house. That was very helpful and very important. And we'll see you next time for another visit.
Okay, thank you.
When patients return home from a hospital stay, they not only need to recover, but they're often faced with new therapies and medications. Healthcare practitioners can conveniently and quickly follow up with patients by telehealth to ensure they understand and follow post-discharge instructions. Add read and write learning to your patient education repertoire to augment your telehealth sessions.